Hi guys, it's Deneb again here, and I got another video on mental health, and I'm actually excited about doing this one because this time I'm actually going to be teaching or giving you some information about the topic that was assigned for me, and the one that actually I got assigned for would be about the Autism Spectrum Disorder. Now, just to give you a little background on this, I'm actually excited about this because we're actually really close to a family that has this. And by what I mean is has this is that their kids have been diagnosed with the ASD. And just to give you a briefer of how it goes is that this lovely couple, a really close friend of ours, they have three lovely children. I believe the ages for the kids are 7, 4, because I know the middle one's about the same age as my daughter, and then they have a younger one that's around a year old. So the reason why I'm telling you this story is because, like I said, they are going through, or their kids have been diagnosed with their ASD. The eldest one that they have has been diagnosed with like these in the spectrum on the severe end of it, and then their middle child is on the lower end of the spectrum. Now, the way I haven't gotten in touch with them for the longest time because of the whole COVID situation, but their youngest one, I believe she already turned a year old or maybe older, and from the last time I spoke with them, they were going to go ahead and have her checked out as well. So for me to be able to like share this information for you, and from what I've experienced with them, this is it's a good learning opportunity for everyone, basically. Now, I might be reading some of this because I have to be a little specific on how it goes, but I'll try to make the video a little bit more entertaining. I don't know what I'm going to do, but I'll figure something out just to make it a little bit more, I don't know, like worthy of your attention. Okay, so as I said earlier, what I'll be discussing is again the Autism Spectrum Disorder. And let me just give you a brief explanation of what it is. Now, again, I'll be as specific as I can. It's a neurodevelopmental disorder that includes your classic autism and the Asperger's syndrome. Now, I'll discuss more about the Asperger's syndrome later as well. It is ASD. It is characterized by persistent difficulties in social communication and social interaction, problems in maintaining relationships, and repetitive patterns of behavior. As I mentioned at the beginning of the video, Autism Spectrum Disorder is considered a spectrum because it can be present in the mild form, which just shows some peculiar behavior or mild isolation, mild autism, to the severe one with profound disabilities in all aspects of life. Okay, so I'm also going to be discussing a little bit about the whole umbrella for the Autism Spectrum Disorder. As I mentioned earlier, I gave you a quick definition on it, but it's it's kind of like a little bit of a larger scale, and I'll give you the 5 main types of ASD. I'll give them a brief explanation on it. I won't go into detail, but at least it's a little bit informative for everybody to know. Okay, so as I mentioned earlier, one of the types there would be Asperger's syndrome. It basically ranges from at least from normal to high functioning ASD. And as a matter of fact, as I was doing some research on this, there's a lot of people that have been diagnosed on this, and they're really smart. They're normal to really high functioning people, but most of them are like really smart. And there's even I'll add out a link again on this as well for like a lot of famous people with Asperger's. Okay, the biggest challenge that they have is their lack of social skills. So people with Asperger's, again, they have a very mild form of autism. It's just that they have a hard time picking up on social cues. The next type would be the pervasive development disorder, also known as PDD. Now, don't confuse it with this guy over here. Okay, it's a different whole thing. But basically, what PDD is it classifies people who do not fit any particular category in the ASD umbrella. Okay, it may meet at least one or two or at least some criteria for classical autism, but not all. Their functional level is usually from moderate to high, so they're quite okay. But and their impairments can go from mild to severe. So it's basically PDD is basically like people with autism that could still function. It's not as mild as what Asperger's is, but it's the next step after that. As long as they're still be able to like function a little bit more, then that's where they classify it to. Okay. The next one would be the childhood disintegrative disorder, or CDD, also known as the Heller syndrome. Okay. This typically affects like the toddlers and preschoolers, and this is actually kind of interesting because what happens here is that as the child grows up normally, from at least the age of 2, then they show like a sudden change when it comes to their social, their communication, and their behavioral skills. It's like they were growing up as a normal child, and then bam, the sudden drop. Now they exhibit some forms of autism. Okay, now usually this one for CDD, it's often overlooked by parents because they call it like a temporary phase. It's like, yeah, it's gonna pass by. It's just a little thing for them, and they'll get over it. That's why most children that were diagnosed with CDD got diagnosed a little bit late. So, I mean, as a parent, I would have thought of that too, but it's nice for us to know things like this. To always just look after your child and how they were growing up, right? Okay, the next type of autism would be Rett's syndrome, and now this is really unique as well. It's pretty cool. It only occurs in girls, in the female gene, and it's the only form in the whole ASD umbrella that can actually be diagnosed and medically confirmed. What happens is that as the girls are diagnosed and confirmed to have this kind of disorder, they suffer from really bad communication impairment. So they can't actually communicate as well. And one common symptom of this is that as the girls start to grow up and change, they have limited ability to use their hands for any kind of physical activity, and as the disorder progresses, it just affects more of their motor skills, and they would really need a lot of help on this. And it's a very severe type of disorder. And then for the last one, for the type of ASD and for the umbrella of ASD, is your classical autism. Now, this one is the predominant form of ASD. This is what we usually call, or where people are classified to be autistic. Now, the way that it works is that if a patient has the signs and the symptoms that basically satisfies the DSM-5 Autism Spectrum Disorder manual, then they are classified as autistic. Now, what is the DSM-5? Well, it's called Diagnostic and Statistical Manual of Mental Disorders, Manual 5. It's the same manual that most psychologists use to assess any types of like mental disorders. Okay. Now, for classical autism, it can vary from your mild to your really severe, and a big majority of patients classified under ASD fall into this category. Now I'm going to discuss a little bit of the clinical manifestations on this, and what was pointed out there is that we should have at least given out 2, but I don't think 2 is going to be enough for this. Okay, so in order for us to understand, like for autism, like how early can you be able to detect or figure out something like this? Now, what happens is that, like for autism, this disorder is diagnosed at infancy, so from like a baby to early childhood, and by early childhood I mean at least a year older to at least 3 years of age, because that's where you start to see that something might be different with the child. So again, it starts out really young. So some of the clinical manifestations on this is for children is like by the time they reach their first year or 12 months, that's when we'll be able to see like little triggers or little signs of maybe they might be diagnosed with ASD. So one thing about that is like, and it's hard because these are younger children, and all children are different. Everybody just grows up differently, right? But one manifestation on this is that for in a year, like after a year, if the child does not respond to their name by 12 months, that might be an indication, because usually children should normally be able to perceive or understand things if they are being called by their names, right? If this child does not respond to the name being called by their first year, then they might suffer from ASD. Another manifestation would be when children do not point at objects that interest them. You know how as you grow up as a child, as a little toddler, they usually point at stuff, right? Well, let's say something caught that child's eye. If the child refuses to point at something like a big truck that passes by, or a loud train, or like, I don't know, like an airplane in the sky. Usually that's what I did with my daughter growing up. If they don't start to recognize things like that, then that's another indication that they might be a candidate for ASD, right? Another one would be avoiding eye contact or physical contact, which is I think a normal thing for people that have been diagnosed for autism. They have that difficulty trying to communicate because they don't try to look the person's eye, and they're very wary of their space. Like as I mentioned earlier with that story of mine, our friend there with their eldest with the severe case of autism, I would always notice that he would not. I mean, he tried to communicate, but he had difficulty trying to express the words, right? And he was very wary about his space. You couldn't just go in and approach him. You couldn't just go ahead and grab something of his. If he's doing something, just let him be, and he's giving him space, right? Another indication for ASD, for manifestation, would be, well, they're flopping their hands, they rock their bodies, or sometimes they spin this in a circle. If a child has a repetitive pattern in this particular behavior, that's another indication of ASD. Another one for manifestation would be delayed speech and language skills. If after the age of 12, and the child has difficulty, or rather 12 months old, the child is trying to have difficulty trying to say, like, like how they make like baby sounds, like mama or papa or something like that, or if they actually stop gaining new skills. Because the thing with ASD is that the child grows up just kind of a regular infant, like as they grow on until they're 12 months old. But they may learn some things, and they may stop learning some new things, some new skills, and then that's one of the challenges in trying to figure out if a child is suffering from autism, and in order for you to figure out what spectrum of the autism they may be classified for. Okay, so moving on to the next question that we have. What is the typical onset for children, or like for people getting ASD? Now, the typical onset for this disorder would usually manifest itself, as I said earlier, from like 12 months and older. Now, there is no certain target population at risk to experience this, but based on my research, in the US, there's about 168 children that suffer from this, and from Canada, it's about 1 in 54. Okay, and also based on from research that as the years progress, it's the cases of autism being detected is getting bigger, and as a matter of fact, ASD affects the male gene about 3 to 4 times more than it does for the females. Now, the biggest challenge about this disorder is that it's uncurable. There is no cure to it. There's some interventions that you can do, but in terms of getting by, it's all just going to be therapy. So it's going to take a lifelong treatment just for this disease, and especially hard is for those children that are diagnosed with like severe autism, like my friend's child there, for example. They are considered to be disabled for life. So again, it's quite difficult. But there's a lot about this kind of thing for autism that a lot of people don't understand. They always have that stigma around it, and I'll go ahead and discuss that further as we go on, okay? Okay, so next thing that we could try to discuss now would be the medication. Is there any medication that is commonly used for this illness? As I mentioned earlier, it's an incurable disorder, but one thing that they can do is there are some medications that can actually help alleviate some of the symptoms caused by ASD, like irritability, aggression, and that deliberate act of injuring themselves. So, some examples of this is like risperidone and aripiprazole. I don't know if I said that right, but I know risperidone. Like that friend of ours, if that's their last resort, but usually what they try to do is they try not to rely much on the medication part, because again, it's how you can try to get ready for it without trying to get into like actual medication. Because one thing about the medication part of that is that, again, it has to be based on their weight and their size, right? And again, these are children. These are their bodies are not used to like the medications like what we're as like older adults. I say I'm old. I accept that, but yeah, for children, it wouldn't be. It's not advised. Even like physicians and people that deal with like autism, like with the disorder, they wouldn't suggest medication as a go-to. But there are some things just to help out if needed. Okay, next thing that we need to discuss here is what is the treatment or the management look for this conditions? And what was indicated is like you should at least give at least 2 interventions of this. Again, this disorder does not have any cure at this time, so it's always just about management of the treatment. That is what is advised for everybody, or for people suffering for ASD. Some of these interventions, they may involve like speech, occupational, and physical therapies. It all will depend on the level of assistance that the patient needs, on like what level of the spectrum that they're on. Now for us, for just future nurses, some of the interventions that we can do, I'll start out with this one, is to maintain safety. I've seen this with my friend. What's important here is you gotta make sure that for any person suffering from ASD, is that you always make sure that they've got some safety gears on them, like helmets, special clothing, arm covers, because they have a tendency to like bite themselves or hurt themselves, because again, it depends on the severity of the disorder. My friend there, I think he's padded out the rooms, his room as well, just to make sure that he doesn't hurt himself. He's got a helmet when he's got his bad days, and there you go. Another way that you could also promote safety is just educating the parents about what may trigger unwanted behaviors. So if the parents know what might actually trigger for them to have that certain change in them, that would be nice. That would actually be a good like preventative method, like learning about the disability, like the disorder, right? I also mentioned earlier about the teaching, or rather about the environmental hazards, like how my friend padded out the walls and something like that sort. Educating parents about environmental hazards, like safety locks and some things like that, just to alleviate any potential harm that may be caused towards the patient, like towards the child, right? Another intervention that we can do as nurses is to maintain an effective communication and support with all the parties involved with the care of the person. So an example of this is like when you try to converse with the child or with the person suffering from this disorder, just use simple, direct, age-appropriate language. Okay, making sure that everyone in the family is involved in the patient's care, and they're open to discuss any concern with each other, because again, our focus there is the patient. Now, when I said about a friend of ours, yeah, he tries to give everybody that knows them information of what's going to go, what's happening, what you can and cannot say, that kind of thing. And as I mentioned, I think the child is about like 6 or 7. Last time I was conversing to him with depending on his age. Now I also know a couple of people with autism that are older, because again, it's an incurable disease. You just get older with it, and but this person was like suffering from I would say like from a mild to moderate. He's changed over the years. I remember him as growing up, that he used to have like guards and everything like that, but he's progressed to like more of like a milder side. That he's way better. I believe he's about 16 or 18 years old now. But the last time I spoke with him, he was just about that age of a teenager. I just spoke to him just like how would you do to a regular teenager during that time. And yeah, he definitely did have a lot of progress regarding this condition, and that's a good thing, right? So we got to treat them like with respect, kind of like with anybody else, right? And lastly, another good intervention that we can do for them is to establish a good routine. You know what I mean? Because for people with autism or with ASD, they rely on consistency. This means we got to make sure that we put out a nice little schedule for them. We maintain a good, consistent team of people to care for them, because they have problems trusting people, right? They have troubles making that connection with people. So having said that, having provided them with that kind of like consistency and care, that would be a good way for them to actually learn and cope as a kind of like management, kind of like treatment for that, right? Okay, the next thing that we need to discuss as well is to, it says here, to give out some sort of a community resource that an individual can actually use with this kind of disorder. So I did some research, and I believe this is the same thing that our family friend is getting. Here in New Brunswick, the government does provide assistance to families and children suffering from ASD. Now, these services include like financial assistance to families and access of 20 or up to 20 hours per week of early intensive behavioral intervention, or EIBI. And what this does is it focuses on identifying and reducing the patient's most significant barrier to learning in their natural environment. In a nutshell, what it is that you get a nice, good professional, like usually it's a social worker or somebody that's been trained to handle ASD, to come into your house and basically just interact, learn about that, and just to help the child get used to it, like get used to their disorder, trying to figure out like if they have the child needs to get out, to help them cope with those kinds of changes as well, right? And I believe that there's also some other places that depending on the spectrum, that you can actually take a child to like a safe place, like a center or an activity hall or something, and there's a lot of them with that same kind of condition, and then that's where they try to help out these kids, right? And from what I've learned from my friend as well, is that not only do they get that social worker that helps them out, but sometimes they're also giving out some sort of not just financial assistance, sort of like babysitter services, kind of that way, just to give the parents a break, right? Because the how should this the stress that you get from parents get from trying to cope up with this kind of condition is difficult. So they're trying to give the parents a little bit of a break, maybe an hour or 2 hours or something, just basically just to help out. And that, again, these are the services being offered here in New Brunswick. Later at some point, I'm going to be adding a link on the bottom and description page, just in case anybody's interested in looking at it, or if you know anybody that actually has this kind of disorder, you can actually just visit the link and learn more about what like our province does, and to assist with this condition. All right, the next question that we have here is how is an individual clinically diagnosed with this kind of disorder? Okay. As I've been mentioning a lot of times now, like ASD is a whole it's a really huge spectrum, right? Now, there are some things that can be noted out in early childhood, like I mentioned, like delayed speech, eye contact, body movements, and everything. That could be an indication for being diagnosed for this. But in order for you to be really clinically diagnosed in this, it has to be a physician or psychologist to officially say that you are suffering from this kind of condition. Now, also based on my research, there's a lot of people that actually do suffer from autism, and but they're highly functioning. And there's a lot of people even that don't know that they're suffering from autism. There's also another website that I'm going to put down on the link below. It's Autism in Canada. That shows you, and it kind of gives you some tools and assessments as well if you want to if you feel that you might be suffering from the condition over there, from this disorder. They will help you out. There's a lot more really good resource material that you could look into that will show you and teach you more about ASD. Now, one thing about ASD is, again, like I said, it's a spectrum, but it also includes the Asperger's syndrome that I mentioned earlier. Now, Asperger's syndrome is, again, said to be like a mild form of autism where a person is having a hard time trying to have a little bit of eye contact, has a little time picking up social cues, like thinking that what they're saying is, how should I say, is already viewed by the other person, by the receiver, as something as negative or hurtful, and they don't understand that. But there's also a big thing about Asperger's that when people are diagnosed with it, that they're still functioning, so they're still fine, right? So again, it all depends on the physician or the psychologist to say if you are clinically diagnosed for ASD. Okay, so for the final question that we have, it's about having any negative stereotypes sorted with this disorder. And I think the biggest stigma that people have with autism is that a lot of people always assume that if you are someone who suffers from ASD or autism, they always feel that you are intellectually disabled. Not true. I'm putting like an A on that. Like I said, since it's a whole spectrum, it can go from mild to severe. Now, a lot of people that actually do have autism, like as I explained earlier about Asperger, they go from normal IQs to actually really high IQs. You can even try to do like a search. There's a lot of famous people around that do have Asperger's, and they confirm that they do have Asperger's and they live with it, and you really think that they were just like normal functioning people. So that's the biggest stigma that I feel that people have about like this kind of disorder. When they think about autism or ASD, they think that, oh, this person is incapable of any conversation or anything. But again, IQ is it's also kind of like a spectrum. It's so wide. There's a lot of ways to gauge IQ. Like you can have a high IQ for this kind of thing, and you may have like a higher IQ for this kind of thing. So a lot of people who suffer from autism, unless it's really severe and it's really detrimental, but they can still function within the society despite having that disorder. And there you go. And that's one thing that we need to go like change about that, our understanding about this kind of disability. Whew. Okay, and there you have it. I hope you enjoyed my discussion about the Autism Spectrum Disorder. I hope you learned something from me, soaring in a little bit of a chatty catty, but I wanted to give out as much information as I can about this disorder. Again, there's some links below. Try to visit them out, learn more about that, and like I always say, this is Dinem. Please be safe and be kind, and I shall see you in my next video.